Hi guys, welcome to today's lecture. Today we will be talking about the treatment of psychological disorders, and this correlates to chapter 15 within you guys' textbook. And so with that, we'll go ahead and get started. So before we get started too far, please go ahead and text Johnny Walker 564 to 22333. This will help you guys be able to participate in the poll everywhere throughout the presentation today, and also be able to practice some of the exam questions that we will be going through today. Okay, so just kind of getting a lay of the land, the goals for today are to help us have a better understanding of what exactly psychotherapy is, who the main fathers of the psychodynamic approach are, what the differences between psychodynamic therapy and behavior therapy are, and what the difference between client-centered therapy and cognitive therapy as well. So to get us started, we will just kind of lay out the historical kind of progress of psychotherapy. We first start with Freud, and this is in the psychodynamic approach. Through Freud, we end up getting the behavior approach. This is often connected with B.F. Skinner, but then there's also a few other researchers that are well known for the behavior approach as well. We then get Rogers, who focuses in on the client-centered approach or the humanistic approach, if you will. And finally, we get Piaget with the cognitive approach. So we'll be walking through each of these today a little bit more in depth to give you guys a good understanding of what each of these approaches are and what specific how they look like in practice. So to go ahead and get us started, go ahead and pause the video, and I want you guys to think about what comes to mind when you think of psychotherapy. Go ahead and text that to the number I had you guys text me as phones. So it will create this word cloud that later on Canvas I'll go ahead and post. And then we'll do this at the after the lecture as well, just to see kind of if our conceptualization of psychotherapy has changed at all. So to start, psychotherapy is the generic name given to formal psychological treatment. This is what is typically used to help clients provide some alleviation from symptoms for clients. So a lot of times the goal in psychotherapy is not actually complete remission from the disorder from the psychopathology, but actually just reducing the amount of symptoms and the amount of impairment that these symptoms have on their day-to-day life. However, the type of treatment often depends on many different variables, but just for our discussion today, we're going to go ahead and focus on only three of these variables. The first is the type of disorder. So in the context that we have, let's say, OCD, schizophrenia, PTSD, and depression, we will treat each of those very differently. And as we'll see in a little bit, each kind of orientation to psychotherapy presents different strengths and weaknesses for different types of disorders. Another important thing to recognize is as clients begin to look for psychotherapy, they're often doing what is called actively shopping. Now, actively shopping is when clients are actually, they have a good idea of the type of therapy that they want to receive. And so they're looking for psychotherapists that do that specific psychotherapy or have that psychotherapy orientation that they specifically want. Now, this is really important in the context of psychotherapy because if someone is actively shopping and taking a part in the selection of the psychotherapy that will be used, they typically are going to be a lot more motivated to complete homework, to engage with the clinician, to engage in the treatment, and to be committed to seeing the treatment from start to finish. Additionally, another important dynamic of this is the hopes of the client. So what is the client trying to get out of psychotherapy? Are they trying to get just a couple symptoms under control? Are they trying to get all of their symptoms? Are they trying to be able just to go to school without being impaired and distress? So it's important to recognize what exactly the hopes of the clients are, because this also will have a huge impact on the type of treatments that we choose. Finally, it's important to recognize that some recent efficacy and effectiveness studies have revealed that treatments for within disorders hold similar effects, again, when that diagnosis is held constant. And so when we are using evidence-based treatments, it's important to recognize that actually a lot of the research is coming out to see that, for example, CBT is not better than behavior therapy, which is not better than client-centered therapy or motivational interviewing. And it really depends on other variables such as type of disorder, motivation of the client, and what we'll get to in a little bit, like the therapeutic alliance. Okay. So to start today, we will start with the psychodynamic approach. The psychodynamic approach is based on Freud and Breuer, who pioneered this idea of psychoanalysis. Now, the treatment specifically really focuses on the unconscious mind. It's trying to understand the feelings, the motives, the desires, and the wants that are surfacing from the unconscious mind and that are in some ways producing these maladaptive thoughts or behaviors. Now, some common techniques that many of you might be familiar with are free association and dream analysis. These are probably one of the most famous techniques. You'll see these with like ink block tests, where we have these blocks of paper that just have like almost like blobs of ink on them, and people try to like make sense of the ink. And then there's also dream analysis, which we'll see kind of a funny example here in a second about. Now, Freud proposed that there are essentially like 3 levels to the conscious mind. The first is the actual conscious mind itself. And now this is the small amount of information or mental activity that we are in fact aware of. These are thoughts, perceptions, those different types of things. And this oftentimes can be compared to an iceberg. And this is the part of the iceberg that we can see. Now, the preconscious mind is something he proposes maybe like at the water level of the iceberg. These are things that we can become aware of if we actually put some effort and some intentional effort towards. These are things like memory or stored knowledge. So, for example, if I asked you guys to recall the first time that you rode your bike without training wheels, you could actually pull that memory, but it would take some effort. Finally, if you guys don't know this, many times with icebergs, the majority of the mass of the iceberg is actually below the surface of the water. And so this is what Freud talks about when he's talking about the unconscious mind. He's saying that actually the majority of what guides us in our life are things that we are unaware of and can actually not really become aware of without someone objectively helping us to start to become aware of some of these things. So some of these examples can include fears, violent motives, irrational wishes. This can even involve like childhood experiences such as traumatic experiences or shameful experiences, which again, we'll see here in a second, an example of which from the Big Bang Theory, where Sheldon helps connect his friend and some of the feelings that his friend is currently having to something that happened in childhood with his mother and some unresolved frustration with his mom. Okay, so we'll go ahead and watch this super quick.
When we first arrived at St. Jude, it was just Claire and I. She was still recovering from...
So, Sheldon? How you doing?
That's how you start a psychotherapy session. How am I doing? I was promised a riverboat journey into the jungles of my subconscious. Instead, I get the same question I hear from the lady who slices my bologna at Ralph's.
I'm sorry, I'll start again.
Would it be helpful to you if I told you about my dreams?
I don't know, maybe.
I recently had a dream that I was a giant, but everything around me was to scale, so it all looked normal.
How did you know you were a giant if everything was to scale?
I was wearing size 1,000,000 pants.
Why don't we just talk?
The talking cure, classical Freudian, good choice. If it will help speed things along, my answers to the standard Rorschach ink blot test are A, a bat, B, a bat, C, a bat, and D, my father killing my mother with a hypodermic needle.
Why don't I just start? Sometimes people have trouble accepting accolades if, on a subconscious level, they don't feel they deserve them. Do you think maybe that's what's happening here?
Really, Leonard? You just going to try to recycle Adler's doctrine of the inferiority complex? I could probably get that from the woman at Ralph's. And she'd let me taste some pieces of cheese for free.
But it could be part of your problem. Let me give you an example. When I was 8, I won a ribbon at the science fair for my project, Do Lima Beans Grow Better to Classical Music? But my mother pointed out that it was just a rehash of my brother's earlier Do Lima Beans Grow Worse to Rock and Roll. I felt so guilty, I gave the ribbon back.
How did that make you feel?
Terrible. I worked really hard on that project. I stayed up all night singing the clown's aria from Pagliacci to a lima bean sprout.
Go on.
It wasn't my fault. I had never seen my brother's project, and my mother could have told me before instead of at the ceremony in front of everyone.
So I hear you saying you're angry with your mother.
Damn right I'm angry with my mother. For God's sake, I was 8 years old. She humiliated me. That's when the bedwetting started again.
Thank you, Leonard.
For what?
Okay, I'll go ahead and stop it there. But again, this provides just a really good example of that connection to some experiences that happen in childhood and ultimately them impacting adulthood. So now psychodynamic therapy and its treatment of psychopathology has increasingly become more controversial because of some of these ties to the unconscious and really not having a good understanding of what exactly the unconscious is. Now, some proponents of this and contemporary therapists work to evaluate the needs and desires and motives through something called short-term psychodynamic therapy, which can be useful in treating very certain disorders. Sometimes PTSD, especially if the the primary trauma was something that happened in childhood. This is a really good opportunity for the individual to begin to understand how that trauma has actually impacted the overall quality of their life and thus created some distress and impairment in their day-to-day lives. So this is a quick video just talking a little bit more about what we have already previously talked about, but I feel like she gives a really good explanation of some of these constructs.
Psychodynamic psychotherapy is a depth psychology, and it's a talking therapy which has its roots very firmly in original Freudian psychoanalysis. So in Vienna in the 1890s, Freud developed this idea of personality not actually being born and a given, but something that evolved and could be influenced by your early environment. And from that, he came up with theories of drives and repression and, most importantly, the unconscious. And psychodynamic psychotherapy draws upon those influences in that it thinks about the psyche as being dynamic, as being able to move and shift, but that there's an unconscious component to it. That means that your conscious mind, your brain, isn't always in charge, in control of how you think and how you behave. So in a psychodynamic psychotherapy, the client will be encouraged to talk about their early memories and their early relationships. And they will be working collaboratively with the therapist in what's called the transference relationship. So the therapist will be trying to encourage those early dynamics, those early ways of functioning, early memories, thoughts, dreams, feelings, things that influenced you in childhood, which may have seemed unimportant at the time, but actually are having an impact on the way in which you're living and functioning in the world today.
Okay, so now that we have this kind of good understanding of what exactly psychodynamic therapy is, I want us to go ahead and answer a few quick questions that will in fact be on you guys' exam. So I'll go ahead and hop to those. And the first of these is going to be working to understand what exactly psychodynamic therapy is. And so you guys can go ahead and text either A, B, or C, A, B, C, or D in, again, that chat that I had you guys link into. And so for option A, it will be a form of therapy based on Freudian theory that's based on the unlearned wants, desires, and the unconscious mind. Now for B, it's going to be unconscious, id, and superconscious. C, it's going to be all about unconditional positive regard, and D is have no idea. So go ahead and pause the video and let me know, and then come back whenever you guys have that filled out. So the correct answer is going to be A. Again, most of the time when we're talking about Freud, it's going to be talking about the unconscious mind and these different motives that come along with the unconscious mind. The other quick question I want you guys to answer is, who are the fathers of psychodynamic therapy? So this is A, option A is Freud and Breuer. Option B is Skinner and Freud. Option C is Rogers and Skinner. And option D is going to be Beck. So go ahead and pause and then come back whenever. So the correct option is going to be Freud and Breuer. Remember, these are the founding fathers of psychoanalysis and really created the foundational work for psychodynamic therapy. So go ahead and hop back to our presentation and we'll move into behavior therapy. So in a nutshell, behavior therapy is a treatment based really on the foundational belief that behavior is a learned construct and can therefore be unlearned through classical and operant conditioning. Now, we've talked a little bit about classical and operant conditioning, but I am going to go ahead and give us a quick recap just to help us remember what exactly those things are. Now, some common examples of behavior therapy are social skills training. This is where the clinician is helping the client to act in appropriate ways in specific social situations. Another one is going to be exposure therapy. This is a technique that's often involved in when there's a feared stimulus and a way to repeatedly expose the client to this stimulus to help reduce the amount of anxiety that they have. Now, I do again want to just quickly go over classical and operant conditioning. So classical conditioning is when we have some situation. There's a famous study done by Pavlov and having to do with Pavlov's dogs. So use that as an example to kind of help us break this down again. So we have a situation, we have a consequence, which then leads to a behavior. And so we begin to pair a situation. In Pavlov's dogs, that's going to be a bell. And it has some type of, we pair that with a consequence. The consequence is going to be the food that we provide to the dogs. And it's producing this behavior of salivation. Now, over repetition, we can actually pair the dogs to salivate every time that they hear the bell. And so in Pavlov's dogs, they actually found this, that over time, when they just rang the bell and didn't even present the food, the dogs began to salivate. That is classical conditioning. Operant conditioning is a little bit different. We have a situation in which has some type of behavior. Now, this behavior has some sort of consequence that we either want to reinforce or we want to punish and get rid of. And so I have two quick examples to try to help us break these two things apart, and then we'll jump into exposure therapy.
This is the reason why I've canceled my doorbell camera subscription.
This brand new
Some psychologists perform operant conditioning with punishment. Maybe we can come up with a punishment for straying off topic.
Not getting to see who wins at pigeon ping pong comes to mind.
We could snap a rubber band on our wrists every time we get sidetracked.
Not bad. You know, in medieval times, idle chatter was punished with a device called the scold's bridle. It's an iron cage that's locked around the head and pierces the tongue.
If only we had one.
Oh, I'll check Amazon.
Okay, so we agree. Whenever someone takes us off topic, they get their arm hair yanked off.
And I really can't let that happen, or the girl who does my eyebrows will think I've been cheating on her.
All right, now, one benefit of quantum coupling.
Well, no question. Who decides if someone's gone off topic?
I think it'll be pretty clear. If not, we'll take a vote. Oh, also.
Ow! We didn't vote.
We didn't have to. That was clearly a tangent. Now, come on, back to work. If we're leaning towards quantum coupling, then we should...
You said quantum coupling. That made me think of the show Quantum Leap. That's a tangent, and it's your fault.
That's ridiculous. Sheldon, I vote that is not a tangent.
Yeah, thank you. And now I owe you one.
Ow! That was your fault.
Yay!
That is a lot of hair. And now I'm gonna hear it from Jenny.
Everyone stop. This was a stupid...
Okay, so I'm gonna go ahead and stop the video there, but that's a really good example of positive punishment. So positive being that adding some type of stimulus that's ripping off the hair on their arms and punishment to stop a certain behavior, getting off topic. So every time they get off topic, they rip off hair from their arms. Now, here's a different example of more positive reinforcement. Again, we won't watch the whole thing.
Are you finished?
Well, thank you. How thoughtful. Would you like a chocolate?
Yeah, sure. Thanks.
What was that?
You said be nice to Penny. I believe offering chocolate to someone falls within the definition of nice.
It does, but in my experience, you don't.
Oh, sorry, Sheldon. I almost sat in your spot.
Did you? I didn't notice. Have a chocolate.
Thank you. What's this cartoon called again?
And it's not a cartoon, it's anime.
Anime. You know, I knew a girl in high school named Anime. Anime Fletcher.
You're here a lot now.
Oh, am I talking too much? I'm sorry. Zip.
Thank you. Chocolate?
Yes, please. Oh, hey, Kim. Yeah, you know what? Hold on. Let me take this in the hall. You'll never guess who they got to replace you at work.
Okay. I know what you're doing.
Really?
Yes. You're using chocolates as positive reinforcement for what you consider correct behavior.
Very good. Chocolate?
No, I
Okay, we're going to stop that one right there, but helps give us a good understanding of what positive behavior is. Positive reinforcement. And so behavior therapy uses these things to help us unlearn a specific behavior and begin to learn more functional behaviors. So then we'll go ahead and move into exposure therapy. So exposure therapy is one of the most effective treatments for psychological disorders that involves a field stimulus. And this includes things like OCD, but also more intensive forms of it, such as prolonged exposure therapy, is really good for treating something like PTSD. So in exposure therapy, we create this fear hierarchy. This hierarchy, for example, in the case of snakes, often starts with someone working on relaxation techniques just when they hear someone say the word snake. Now, through many sessions, they begin to become more relaxed. And after becoming more relaxed, we move up in the hierarchy. And over time, we're able to progress throughout this hierarchy to ultimately, they're able to actually hold a physical snake and practice these relaxation techniques and not feel anxious at all. So again, helping to relearn some of these behaviors. So I want us to take a second to go ahead and answer another question, and that is to identify 1 to 2 key differences between behavior therapy and psychodynamic therapy. So go ahead and pause the video, type out 1 to 2, and then hit play again, and I'll give you 1 to 2 options. So one difference between the two is behavior therapy focuses on maladaptive behaviors as a learned construct and thus can be unlearned, while psychodynamic therapy views maladaptive behaviors and thoughts as surfacing from the unconscious mind. Additionally, behavior therapy uses things like classical conditioning to help us begin to unlearn some of these behaviors. Psychodynamic therapy helps us to begin to tap into our unconscious and have a better understanding of where exactly these things are coming from, ultimately tracking it down throughout childhood or lived experiences or needs or wants. This moves us to client-centered therapy. So client-centered therapy emphasizes highly this idea of the therapeutic alliance. Now, the therapeutic alliance is one of the most well-known factors that actually affects the outcomes of psychotherapy. Therapeutic alliance, specifically, when we define it, is the relationship between the client and the clinician. This is the amount of depth and how quickly they're able to build rapport or the strength of their relationship, the trust in which they share. And this is really lays the foundational work for client-centered therapy. This approach is an empathetic approach where the clinician actually helps the client to begin to fulfill their individual potential by helping them develop a greater sense of self and a better understanding of themselves. So some common techniques or tactics that are used during client-centered therapy is reflective listening. And we'll see an example of this here in a second, but this is when the therapist repeats the client's concerns to help clarify what they're actually feeling. Additionally, there's this thing they utilize something called unconditional pause and regard. This is when the therapist begins to view the client without judgment in the therapeutic room. This helps so that the client feels comfortable to be their most truest self and ultimately helps them in this endeavor and journey to beginning to shift and change into fulfilling their greatest potential. Now, some common techniques of this is motivational interviewing, and this is more of a dynamic dance. It recognizes that the client and the clinician are both expertise in the therapeutic room, and it recognizes that the client is an expert on themselves, while the clinician is a expert in psychotherapy. Has been a proven technique for alcohol abuse and drug abuse. So we'll go ahead and just watch a quick little explanation on motivational interviewing.
A performance that truly matters.
Fundamentally, motivational interviewing involves a change in role, a change in how you think about what you're doing. You're not the expert there to fix the person. You don't have to make the person change. The truth is, in fact, that you can't make a person change. You don't have to be the one to come up with all the good ideas. A person with really good ideas is sitting across from you and may have better ideas than you do. It's not like a competitive sport. It's not like wrestling where you try to defeat and pin and outsmart and outwit the person. It's more like dancing together, moving together, adjusting your movements to the other person. Overall, motivational interviewing is not a directive approach. Neither is it just a following approach. Following is listening to the person and kind of going wherever they go. Motivational interviewing is in the middle, between those two, and we describe it as guiding. If you go to another country and you hire a guide, you don't expect the guide just to follow you around. That's not what you're looking for. Neither do you expect the guide to order you when you will arrive, when you will leave, what you want to see, what you will enjoy, what you're going to do. That's not a good guide either. Good guiding involves good listening, as well as using your own expertise. A good guide will find out where you want to go, what you're interested in, what you're hoping for on this journey, and then help you get there using his or her own expertise, enjoyably, safely, efficiently, perhaps. That's the guide's job. Not solely directing, not solely following. There's some of each in it, but it's a blend of those things. This may or may not be the way you've been thinking about your own work, but we invite you to try.
Whoops. Okay. So then this is a really good example of what this idea of reflective listening looks like. Again, it's a little bit funny, but also just how she begins to rephrase a lot of things that Sheldon is saying.
First, there was PlayStation, aka PS1. Then there's PS2, PS3, and now PS4. And that makes sense. You'd think after Xbox, there'd be Xbox 2. But no. Next came Xbox 360. And now, after 360, comes Xbox One. Why one? Maybe that's how many seconds of thought they put into naming it.
Can you get the butter, please?
You know, however, with the Xbox One, I can control my entire entertainment system using voice commands. Up until now, I've had to use Leonard.
Then get the other one. Pass the butter.
Hang on. I don't feel like you're taking this dilemma seriously.
Fine, Sheldon. You have my undivided attention.
Okay, now, the PS4 is more angular and sleek looking.
No way!
It's true, but the larger size of the Xbox One may keep it from overheating.
Well, you wouldn't want your gaming system to overheat?
No, see, well, you absolutely would not. And furthermore, the Xbox One now comes with a Kinect included.
Included?
Yes. Not sold separately. Although the PS4 uses cool new GDDR5 RAM, while the Xbox One is still using the conventional DDR3 memory.
Why would they still be using DDR3? Are they nuts?
See, that's what I thought. But then they go and throw in an ES RAM buffer.
Whoa, wait a second. Who's they?
Xbox.
You're kidding!
No, I am not. And this ES RAM buffer should totally bridge the 100 gigabit per second bandwidth gap between the two RAM types.
This is a nightmare. How will you ever make a decision?
You see, I don't know. What should I do?
Please pass the butter!
Okay. So notice how she was restating a lot of things that Sheldon was saying. This is a very common tactic, and it's called reflective listening during client-centered therapy. So we'll go ahead and move into, and we'll try to make it somewhat fast, but cognitive therapy. Cognitive therapy really focuses on this idea that maladaptive thoughts are distorted and thus need to be adjusted and be modified. And so we have some common types are cognitive restructuring. This ultimately strives to help the client recognize that there are maladaptive thought patterns and help them replace them with a more realistic perspective of their environment and their surroundings. While mindfulness-based cognitive therapy helps clients to begin to learn and disengage from ruminative thinking through meditation. This allows the client to become fully present in oneself and to completely disassociate themselves from this ruminative thinking that entraps them in this distress and impairment. Now, cognitive behavior therapy then later came on and integrated these two techniques, behavior therapy and cognitive therapy, and it kind of mushed them together. It integrates them by help correcting these negative thought patterns and correcting these maladaptive behaviors in a succinct treatment.
What is CBT? Cognitive behavioural therapy may sound quite daunting, but it really is quite simple. CBT is a proven treatment to help when we are struggling with stress, anxiety and low mood. So let's break it down. CBT combines cognitive therapy, looking at how we think, and behavioural therapy, looking at the things we do. Don't let the word therapy put you off. CBT is a very practical approach that focuses on the here and now, giving you tools to take on life's challenges. The idea behind CBT is that our thoughts have a big impact on how we feel and behave. Here's an example. Let's say you've been invited to an event. You may start thinking negative thoughts. This may then cause you to feel uncertain and anxious, which might make you feel like not going, or using unhelpful behaviours to help you cope. Over time, this cycle of thoughts, feelings and behaviours can become a habit, making it difficult to shift. This is where CBT can be a big help. CBT teaches you to start noticing the unhelpful patterns of thinking and behaviours that cause distress. It teaches you how to see things in a more balanced way and choose behaviours that help you get to where you want to be in life. CBT really works. Study after study, CBT stands out as the most effective treatment for mental health challenges. Want to know more? Check.
So then I want us to go through and begin to identify some of the, give me one quick second, the differences between client-centered therapy and cognitive therapy. So go ahead and pause the video and come back whenever you guys are ready. So some of the differences in client-centered therapy really focuses on that therapeutic alliance and providing an empathetic space in which we can provide unconditional positive regard to help the client fulfill their potential by helping them have a better understanding of themselves. Cognitive therapy really begins to look at individuals' thought patterns and the ways that they think about their environment and make sense of the world around them, and recognizes that these thought patterns are in fact distorted, and it treats that through trying to replace these distorted thought patterns with more realistic thought patterns. So then we get into family therapy. So sometimes therapists may want the family to be a part of treatment because the family is such an important agent of this change of the self. And so the whole family then is considered the client. And a good example is actually from your textbook. So if we take a child's deviant behavior, which has led to conflicts between parents, we then can focus treatment on both the child's behavior and to help the parents to begin to resolve their conflict, which then helps the family structure and the family system as a whole begin to heal from these two conflicts and maladaptive behaviors. Now, during family therapy, they tend to focus on what's called this expressed emotion. Now, this is a pattern of negative actions by a client's family members. So this can include different types of things such as critical comments, hostility directed towards a person by the family members. So in that example of the deviant child, potentially we have some hostility from dad towards the kid, and this can be a negative action that is negatively impacting the child. And then sometimes also emotional over-involvement. So recent research has actually linked the amount of expressed emotion from family members to relapse rates in psychopathology. And so it's a really important construct for us to begin to understand and actually tease apart. So then we have group therapy, and it's a little bit different than family therapy. It's typically organized around a particular problem or a type of person. A good example of this could be alcohol abuse or sexual abuse is the focus of the problem. Now, the groups typically range in the amount of structure that they receive, ranging from highly structured, this is exactly how the group will go, this is the beginning, the middle, and the end, and this is how we talk about things, this is how each member of the group interacts in the group, to loosely organized. We kind of just show up and begin to chat about our experiences. Now, some of the advantages of this is it can be oftentimes a lot less expensive than individual treatment, and it can begin to help the client have not only improve their social skills, but then begin to recognize other people's learned experiences and to learn from others and their experiences, helping them to recognize that they're not alone in their experiences and that there is a way to positively move through some of the distress and impairment that they're experiencing. So as a final activity for today, I want us to go ahead and provide just one advantage to group therapy specifically, go ahead and pause the video and then we can come back. So you have one of two options, and I'll go ahead and go back to my last slide. Again, it's going to either be oftentimes less expensive than individual treatment, or two, it is going to provide the client with an opportunity to improve their own social skills and recognize and learn from the experiences of others. So today, that's all I have for you guys. Please go ahead and study from these questions. They will be on you guys' exam. And if you guys have any questions, go ahead and email me. I'm happy to provide any clarity if you guys have any questions about the material today. Okay, we'll see you next week.